In light of National Athletic Training Month, this presentation is meant to spread awareness of all the responsibilities that are typically seen throughout the profession. This presentation is conducted by myself, DJ Gamage, and my colleagues Bailey and Fabian. So first off, Bailey, second-year student over at the University of Colorado in Boulder, is going to show us what the general definition of an athletic trainer is and what their typical responsibilities include.
What is athletic training and the athletic trainer? The National Athletic Trainers Association, or NATA, defines an athletic trainer as a highly qualified, multi-skilled healthcare professional who renders service or treatment under the direction of or in collaboration with a physician in accordance with their education, training, and state statutes. An athletic trainer is not a personal trainer, strength coach, or physical therapist. Athletic trainers carry out many roles, including injury prevention, assessment, evaluation, treatment, rehabilitation, emergency care, referrals for physical therapy or surgery, field setup and breakdown, hydration, and return to play. Athletic trainers can gain many certifications, including Graston, dry needling, active release therapy, PRI, and strength and conditioning. Athletic trainers can also work in many different settings, including the high school setting, the college setting, including D1 colleges, NAIA community colleges, professional teams, military, hospitals, stunt doubles and movie making, Disney, such as Disney on Ice, industrial setting, and the private clinic. What is athletic?
Next, Fabian over at Arizona Western Community College is going to show us what a typical community college facility looks like and what the responsibilities of covering multiple sports at this level usually entail.
I'm with me on a quick little tour of Arizona Western Community College. Here, as you're looking at right now, is our softball field, and on the home side right here is our batting cages. Next, I'm going to take you guys to our soccer fields where our men's and women's soccer team compete. Usually their games will start at 4 for the men and at 7 p.m. for our women's, just because of how hot it gets here. This year, both of our teams were able to participate in the national tournament, both being ranked above 5th in the nation. Our men's ended up sadly losing in the play-in rounds, and our women's losing in the championship game by a golden goal. Next, we're going to be taking you to where our soccer teams usually practice when the field is being painted or fertilized. Next, right here, you have our baseball fields. Just a quick little tour around. Yeah, since it's a community college, we don't really have a big facility. Everything is all jam-packed right next to each other. In here we have our athletic training room where we have a hydroculator, a couple of our rehab modalities. We have about 4 treatment tables, a bunch of foam rollers. We do have some yoga balls for treatment. In the corner we do have our medicine kit, and in here we have our cold tub with our ice. Speaking of a cold plunge, here I am setting it up for our game, just in case we have any heat illness. Thank you. Yeah, this is me getting ready for one of our soccer scrimmages. This is one of our guys, getting ready for a warm-up right before our game. Some of the modalities that our athletes do like to use is one of them being the cold plunge after a hot day after practice. Another one would be the cupping. This is usually popular with our baseball and softball athletes. Here we do have dry needling, which is fairly new to us just because one of our athletic trainers was able to get their dry needling cert. And here is me getting dry needled on my neck just due to some bad sleeping positions. Right here's one of the photos that I took while we were up in Kansas. I was lucky enough to be able to travel with our team there as while we were with our men's and women's team, supporting them and making sure that they were healthy throughout the whole tournament. This year, I was lucky enough to be able to be in an operating room to be able to see a knee surgery. The athlete was one of our baseball players that ended up getting an ACL repair, along with both lateral and medial meniscus repairs as well. I appreciate your time and looking at my life in Arizona Western. Thank you.
All right, so outside of the traditional settings of secondary, college, and professional sports, there's a variety of settings in which athletic trainers can also work and show their value. First of which being in the industrial setting. Many corporations now employ athletic trainers to care for the well-being of their employees with the goal of minimizing job injuries and reducing workman's comp cases. To achieve this goal, athletic trainers will instruct employees on how to use proper body mechanics during the tasks in which their jobs require. They'll coach employees on how to work ergonomically so that they can achieve these tasks efficiently. They also show employees stretching techniques so that their bodies can handle the loads in which they'll face. Behind the scenes, athletic trainers work with the company's safety teams to track injury trends and compose new procedures to counter these trends. Also, educational seminars are conducted to promote long-term health throughout the life cycle of the corporation's employees. So overall, this setting takes a deep dive into the preventative side of healthcare. The next setting is the military setting. So, this is another growing setting in which athletic trainers are beginning to demonstrate their value. Athletic trainers can act as healthcare providers for military service members and their support staff at military bases and basic training locations. They either work out of the base's clinic or they're assigned to a squadron which they watch over. Athletic trainers handle many acute and chronic injuries as well as provide pain management similar to that of a PT clinic. This setting typically deals with less acute care and no emergency care compared to the traditional settings. Athletic trainers spend a large amount of time educating patients on healthy lifestyle choices, including nutrition, prevention, stretching and mobility, and how to properly lift objects. For many patients, the goal of their treatments is to give them the ability to perform their activities of daily living, which rely heavily on creating home exercise programs. The main obligation of the military athletic trainer is to ensure that all their patients are mission ready so that they can be deployed when the time comes. And this is a little facility tour video of what a military athletic trainer's clinic will look like. This is at Davis-Monthan Air Force Base here in Tucson, Arizona. So as you can see, there's cabinets with wound care and different things here. As we move around, there's treatment and evaluation tables with curtains for privacy if needed. There's some modalities back there. Here's a little chiropractic room where chiropractors will come in and provide their services. An in-body body composition machine, and the rehab room with everything you'll need there. This brings us to the clinical setting. The typical day in the life of this setting includes conducting full evaluations of patients, reviewing imaging with overseeing physicians, and overall just creating treatment plans for patients before referring them to their proper specialists. This is an example of some athletic trainers working in the clinic. It looks like with some rehab as well. So outside of doctor office clinics, there's also your PT clinics and things of that nature. This is a little video of Banner's clinic in the Scottsdale area. All right, so the next and final setting that athletic trainers can find themselves in is the operating room. So ATs are very useful in this setting, typically acting as the first assistant to the surgeon. These duties include properly positioning the patient prior to the operation taking place. They perform the sterile draping of the patient. During the operation, they can also assist in retracting tissues. They can help in reducing joints if that is what the operation calls for. And they also just organize and assist the surgeon with all the tools that they will need for the operation. Once the operation has concluded, they go ahead and help by suturing the wound. They apply sterile dressings over the sutures, and if any bracing or slings are needed, they can assist with that as well. Once it's all said and done, the athletic trainer can assist in giving the patient instructions on their restrictions and what they need to do basically up until their follow-up appointment with the surgeon. This is a little video of a tour of kind of like what an operating room looks like. So where an athletic trainer would be working hand in hand with the surgeon and other nurses. All right, so in virtually all settings of athletic training, there are some administrative duties that come along with the job. These duties include, but are not limited to, budgeting, making policies and procedures, as well as just interdisciplinary work, which includes communication with all the healthcare providers that a patient may see. This is an example of some admin stuff. So this is a athletic training staff meeting over at the University of Arizona, where I am currently at. And we discuss many things. We have these meetings on a bi-weekly basis where we bring up new business or concerns. We also have the different athletic trainers act as liaisons for different departments, so that's where that interdisciplinary work is discussed. We also get feedback on cases. If someone has a special case that isn't very common, just to pick each other's brains and bounce ideas off of each other. Also, we plan out events and any future needs as different things come up. Thank you so much for watching this presentation. I hope you all have a better idea of what an athletic trainer does and what the field of athletic training entails. Go Jacks!